Welcome back to the Dr. Sia channel. You're about to watch a video between myself and Chantel, who is experiencing complicated grief and a defense mechanism called intellectualizing. Now, if you don't know what defense mechanisms are, make sure you check out my video here on the Dr. Sia channel on defense mechanisms. And we're about to look at how we can help Chantel deal with this defense mechanism called intellectualizing. Now, I don't want to spoil it too much for you before you actually watch the video, but make sure you stay put because after the video, I'll break it down for you. I'll let you know what I saw, why I did what I did, and where we would go from there. So stay tuned and I'll see you soon. Chantel, what are the problems you've been having?
Well, it's been going on for a bit of a while now. So my sister was diagnosed with cancer about a year ago. And of course, the family's been dealing with all that sort of thing. And I've been watching them go through that and everything. And about a month ago, she was hospitalized sort of indefinitely. And she was receiving medication and all that sort of thing. And yeah, after about a week in hospital, she passed away.
Okay. And so you just recently lost your sister.
Yes, that's right.
And what are the problems that you come in here for to talk to me about?
I mean, I'm just coming in because, it's a common thing.
Yeah.
It's cancer's a common illness, and it's something that people go through quite a lot. So I figured I should just get a second opinion on it,
Okay.
really, yeah.
Yeah. And have you been grieving the loss of your sister at all?
I mean, look, the family was there. Everyone was with her in her last moments, and everyone sort of said goodbye to her, and so yeah, we were there with her for the end of it and everything.
That moment you said everyone was saying goodbye to her, and then can you tell me more about that?
I mean, we were pretty lucky. Like she wasn't in pain. The doctor was saying that all of the drugs and everything that they were prescribing to her were helping out. So she was at peace. It wasn't bad. Like it could have been worse. Yeah.
And were you there when the doctors came around and
I was. Yeah. My family was there, so I was there also.
all right. And you were there the whole way through?
Most of the way. Yeah.
Most of the way. Yeah.
Yeah.
And as we're talking about this right now, what do you notice feeling inside?
I mean, it like statistically speaking, thousands and thousands of people go through it. Like cancer is a really common cause of death. It's something that a lot of people go through, and so I don't think it's a common thing, and that's something you have to go through, I guess. Eventually, everyone dies at some point. So
Sure, yeah. Chantal, did you notice that I asked you how you felt when you were there with your sick sister in the hospital and the doctors coming in and giving you information and that, and you said that you were there most of the time. And I asked you how you felt about that. But then what you talked about is sort of the events around it and how cancer is common. Did you notice that happened there?
um, a little bit, I guess. Yeah.
It's like you were intellectualizing. Did you notice that? It's like you're
Yeah.
talking about the intellectual aspects of cancer as opposed to your feelings.
Oh, okay. Yeah.
So if you don't sort of intellectualize, how do you notice feeling? As we're talking about you being there with your sick sister in the hospital.
Well, I mean, it was all planned. Like we knew it was going to happen, and so we were all prepared for it, I guess, essentially. So like, I suppose it would have been worse if we weren't prepared, but we were. So we knew what was going to happen. We had the medication prescribed for her. Like it was all as good as it could have been, I suppose, in that situation.
Yeah.
I mean, statistically speaking, like a lot of people don't expect that and they don't realize the end's coming, and so it's a lot more shock and all that. But it's just not something that we had to deal with. Yeah, we're ready for it.
You're sort of saying that you were ready for it. You were prepared for it.
Well, I mean, we didn't know the exact date that it was going to happen, of course, but essentially, like, we knew it couldn't be too far away. So we were just, I guess, we were there with her as much as we could be. We were just waiting it out, really.
Sure.
Yeah.
Yeah. And you were there and you were waiting it out and you were prepared for it and you weren't shocked as much as some other people would have been shocked.
No, no, definitely not. Like, it just, yeah, it could have, like, a lot of other people would be shocked, but
Right.
we didn't have to deal with that at all. Like, we were really,
Right.
yeah.
And and in that, I asked you how you felt when you were there, and you were noting that you were prepared and your family was prepared, and you weren't as shocked. Did you notice that that sort of is intellectualizing it again about sort of the planning and the preparedness of it all, as opposed to how you felt when you were there with your sister? Did you
Okay.
notice that that happened there?
Yeah, sure, yeah, yeah.
Yeah. In a way, it's like some part of you, when I ask you how you feel, as we're talking about you being there with your sister in her final moments, some part of you says, talks instead about the preparedness and how you knew and how you were ready for it and you weren't shocked for it. Do you think this intellectualizing part, this part that keeps you thinking about the structural aspects of it, the planning aspects of it all, do you think that sort of gets you away, focusing away from something that's important to you, something that's important to all of us when we lose somebody?
I mean, everyone has a different way of, I suppose, coping with things and getting through things, you know. And I mean, typically, other cultures don't always sort of go through things the same way that we do, you know. It's
Uh-huh.
everyone deals with things differently, and I think that's completely normal. I have my
Sure.
own way of dealing with it all. Yeah,
Sure.
yeah.
Yeah. And there's some idea there again that you have your own way of dealing with losing somebody,
Hmm.
and that there are cultures that don't have grief
Yeah,
and the
yeah.
grieving process. I'm curious about this. What is your way of dealing with this?
I mean, I think just, you know, getting on with things as much as you can, you know,
Hmm.
just going back to work and staying distracted and busy and all that, because otherwise, you know, it's pointless. Like, you live for X amount of years, and so there's no point just, you know, stopping for a few years when you could be sort of producing good work and doing other things and sort of using your skills and all that. Yeah.
Sure. Okay. Yeah. So there's some idea that to heal for you is to move on, to distract yourself, and to get back into doing work in that. And I'm sure that there are some aspects of that that's really healthy as well. But I'm wondering if there's some aspect in this rushing nature into quickly distracting yourself from it all. If do you think that there's something there that almost makes you or prevents you from healing?
I mean, I don't see the, like, I feel like that is what heals me, you know. I don't have the
Mhm.
need to sort of sit out and heal myself and grieve and all that. Like, you
Uh,
know, like I said, other cultures, they don't always do
sure,
that. Some of them just get straight back to work, and I feel like maybe that's more what I'm
sure.
inclined to be doing
All right.
as well. Yeah.
It sounds to me, I don't know what it sounds like to you, Chantal, but it sounds to me like there's a bit of intellectualizing going on there again. That there's a
Okay.
bit of you that's sort of looking at other cultures and how they do things and how it's whether it is useful or not useful to grieve, as opposed to sort of looking at how you actually feel as we're talking about those final moments that you were there with your sister. Do you notice that?
Yeah.
We're getting into a conversation here about, is it good to grieve? Is it not good to grieve? Is it useful to grieve? Is it not useful to grieve? And I'm supposing that those are important conversations to have as well. But one thing that I'm wondering is, could there be that that's an intellectual aspect of it all? The philosophy of whether we should or should not grieve. I'm wondering, what are your actual feelings as we're looking at these final moments that you were there with your sister? What do you actually notice yourself feeling?
I mean, it it could have been worse. Like, some people, I mean, some people lose their entire family,
Right.
whereas I've only lost, well, one, really. So I've still got, the rest of my family with me. I've still got them, and if anything happens, like, they're there for me, I suppose. Yeah.
Okay. Yeah.
So
It seems like we're moving a little bit into this idea that some part of you rationalizes that, well, it could have been worse. It's not too bad, as bad as it is for some people, because you've only lost one sister, but some people lose their entire family.
yeah.
All right. Do you think it might be useful for us in our next session to talk a bit about this rationalizing that's going on for you?
Yeah, sure. If you think that would help the situation, yeah.
Well, let's see if it does. I'm not sure, but let's have a conversation and see where we go.
Okay. All right.
All right, so that was session 1 between myself and Chantel, who's experiencing complicated grief and intellectualizing. Let's just break down what complicated grief is first. So, complicated grief is a process that happens for a person when their natural grieving processes are compromised. If you want to know more about complicated grief, make sure you check back into the Dr. Sia channel, because I'm going to create a video on that for you. Now let's get right into the intellectualizing that we were seeing in this session. So basically what had happened for Chantal was that she had lost her beloved sister. And you would expect for anybody who loses a beloved family member that they would be experiencing grief, right? Sadness, that they'd be really sad about the person that they've lost. But did you notice what was happening there for Chantel every time I asked her how she feels about being in that room with her sister and having lost her sister? What she would do is intellectualize instead. So, what is intellectualizing? Well, intellectualizing is when some part of your mind just goes to the reasonable aspects of something, the logical aspects of an experience, the statistical aspects of an experience. So let me give you an example. When I would ask Chantel, how did you feel when you were there with your sister and you knew that you were going to lose her? You're there in the hospital. She'd say, well, cancer is a common thing and it happens to a lot of people and a lot of people experience it. And that's all true. But think about it. What was the question? The question was, how did you feel? And what happens is that intellectualizing then comes up, reduces her feelings about that moment, and instead sort of brings her frontal lobe into activity, makes her think about it instead of feeling it. And that is one way that grief can get complicated. So one thing that her and I were doing together is helping her see when the intellectualizing was happening, because it was happening for her automatically, questioning its utility, and then seeing what happens if she tries to make it stop. So if she consciously tries to make the intellectualizing stop. And you saw that success, because by the end of the session, she managed to push the intellectualizing aside. And then, of course, instead what happens is that rationalizing came up. So we agreed that for next session, we're going to work on her rationalizing instead. So if you're interested and curious about finding out more about rationalizing, make sure that you tune in next week to our next session here between myself and Chantel, where we're going to look at see how we can help her get more in touch with herself and the feelings that she does have by removing her rationalizing. I look forward to seeing you then. As per usual, remember to subscribe, like, comment. I obviously do what I do in sessions because of the training that I have, but you might have different understanding about things. You might have different ideas and opinions, and I really look forward to reading them too. So I'll see you soon.